Hello everyone, good morning everybody. I am Sanya from Brother Wellness team and I'm sure all of you must be keeping good health. Today we are going to discuss a very important topic that is renal calculi. Stones are hard deposits made of minerals and salts that form inside the body. Diet excess, body weight, some medical conditions and certain supplements and medications are among the main causes of stones. There are many types of stones like calcium, uric acid and cystine stone, etc. Stones can occur within the kidney itself and as well in the uterus, the tube draining urine from the kidney or in the bladder. To throw more light on the subject, we have with us and what or right for diagnosis and treatment of urinary system stones. Today we have with us renowned urologist Dr. Siddhart Singh. Dr. Siddhart Singh is a urologist by training and has completed his MCH Urology from D.Y. Patil Medical College and Hospital, Pune in 2022, MS General Surgery from Mahatma Gandhi Medical College and Hospital, Jaipur in 2018, and MBBS from MGM Medical College in 2014. Dr. Siddhart Singh has rich experience in the field of urology and carries out the treatments utmost precision and efficiency, ensuring that patient health is in safe hands. Doctor, a very warm welcome to you.
Thank you so much. Thank you for inviting me to your show.
And as we are going to discuss about a very important topic, that is kidney stone. So first of all, my very first question to you is that why kidney stone is becoming so prevalent nowadays?
So kidney stones are basically stones that are formed inside the kidney, and the cause, the cause for it is mainly our lifestyle changes that have occurred in the last few decades. Our food habits, our dietary intake of fluids, water, and these are the main causes that are causing more kidney stones as compared to our elders. And we'll discuss the causes as we go along the show.
Yes, definitely, doctor. And we are talking about kidney stone. Why basically kidney stones are formed?
Yes. So the basic crux of it is the urine that is produced from the kidneys is made up of two things. It's the fluid and the salts. So anything that causes the imbalance of the two, when the salts go high and the fluids go low, it causes deposition of the salts in the kidney, which leads to formation of the stones. So the main criteria for a kidney stone formation is the either the salts going high or the fluids going low. So depending on what salt is getting deposited, that is the kind of kidney stone that is formed in the kidney.
Okay, so that's why the kidney stones are formed. And as we've discussed that we'll be talking about the causes. Doctor, what are the various type of causes for kidney stone?
Yeah, so as I said, the causes are simple as if we have less water intake, that is the primary cause. So the fluid intake will be less. There'll be dehydration, which will lead to less fluid in the urine, and more the salt deposition will be more. Or if there are the salts that get deposited, like calcium, like phosphorus, like uric acid. These are the types of stones, that the salts that get accumulated, and if that is increased in our diet, that will also lead to the formation of renal stones. So for that, we need to know what are the types of stones. So I'll just discuss. There are basically four types of stones. There's a calcium stones. There are the which can be calcium oxalate, monohydrate, dihydrate. Then there are the uric acid stones. Then there are the struvite stones, which are the infectious stones. And then there's a separate group of stones, which are cystine stones, which are fairly less common, but they have a genetic predisposition. So they are basically those stones when the patients have a genetic vulnerability to stones.
Okay, so these are the various types of stones. There are basically four types of stone, as you said, doctor. Doctor, is it like that vomiting or nausea also happens in this case?
Yes, so vomiting and nausea are basically these are late symptoms when the stone gets stuck in the passage of the ureter. There is accumulation of the urine inside the kidney, which leads to distension of the kidney, which leads to us, the pressure symptom gives a signal to the brain, which causes the sense of vomiting, which is nausea, and it may even lead to vomiting. So that generally happens as a feature of when the stone is either stuck in the ureter, causing hydronephrosis, or in our terms we call it hydronephrosis, when there is the increase in the size of the kidney, which leads to that signal to the brain. So it is not directly related to the stones as such, but when the stones have their effect, then these symptoms can come. Some patients come with only vomiting and nausea, so they may be having stones for a long time, and they may not have realized it. And now, when the kidney has increased in its size, these symptoms come.
Okay. So, is it like that there are different symptoms for different people?
Yes, there is a group of symptoms that happen for kidney stones which are similar. So the most common symptom is actually pain, which is in the side of the kidney. So as we know, the kidneys are generally placed in the retroperitoneum, which is on the back side, closer to the back. So the pain starts from the back, and it goes along the flank region, along our sides, and it can come towards the center in the lower part of the abdomen, and it can even radiate to the genital organs as well. So that is the root of the pain. So if a patient has a particular symptom of a pain from the flank to the groin, so it can be almost certain that it is a pain due to some pathology in the genitourinary system. So that is the most common symptom. But we find patients, there are a number of patients who have not had any pain, and incidentally they come to know that they have got a kidney stone. Incidentally they come to know, and they don't have any symptoms. That basically, the pain is also a component when the stone is giving some problem to the kidney. If it is in a place where it is not that big, and it is not causing any compression to the pelvic calyceal system, as we say. So in those cases, pain may not be the first feature. There can be other features, such as the patient will have increased frequency of urination. He will have some burning micturition in the burning sensation in urine. There can also be blood in the urine, which is called hematuria. So these are some symptoms that can occur. Other than that, the ones that we've already discussed, nausea and vomiting, these are also symptoms of renal colic pain.
Okay, so these are the various types of symptoms which are of kidney stone. Doctor, when we are talking, you have already discussed about the causes as well. Are there any genetic causes as well? Is it like that if somebody is from the past having kidney stone, can kidney stone be passed from one generation to another? Is it like that?
Yes, as I had said, there are 4 types of stones. So among them, there's a group called the cystine stones, which have this genetic predisposition, as we say. So people who have cystine stones, it is in our literature, there is evidence that it is carried on genetically. But the good thing is that it is a very small number. It is a very small percentage of the number of stones, and it is the treatment module is almost same to the other stones. So there's nothing different that we have to do for cystine stones. Like we treat the other stones, we can do the same preventive measures as well as treatment measures for the cystine stones as well.
Okay, doctor. And when we are talking about the measures, we have already discussed about the causes, symptoms, and the types of kidney stone. Now, moving on to what are the treatments which are available for kidney stone, doctor?
Yeah. So first of all, the main factors that warrant the treatment are, one is the size of the stone, and one is the location of the stone. These are the two main important factors. So if the stone size is small, uh, and if it's in a preferable location, the first treatment that we give is a medical management. We give medicines, we give we ask the patient to have more fluids, and so that the urine output increases, there is more urine produced by the kidneys, and these small stones can be flushed out. So generally about 8 to 10 millimeters of stones, that is the cutoff that we keep to manage stones on a medical management basis, or with medicines, with fluids, with supportive therapy. The other factor is the location. It should be in a preferable location in the kidney. The kidney has small major and minor calyces where the stones are, can be placed. So if it is in a lower pole, it gets a little difficult. Even if it's a small stone, if it's in the lower callus, it gets a little difficult to be managed through medicines. But still, the cutoff is about 8 to 10 millimeters of stones we try to manage with medicines. But once the stones reach a size above 1 centimeter, because the size of the ureter is small, it is not feasible to treat them with medicines and fluids, because they will eventually get stuck in the ureter, and that will cause more problems, more pain, more symptoms to the patient. So for these set of patients, we give them surgical management. So with the advent of technology, we have almost incisionless procedures for all kinds of stones. So we have a PCNL, percutaneous nephrolithotomy, which is the gold standard treatment for stones above 2.53 centimeters, which can be done with a smaller scope, which is called a mini PCNL. And nowadays, with the advent of lasers and flexible ureteroscopes, there's a procedure called RIRS, retrograde intrarenal surgery, where there is a completely incisionless surgery. There is no incision, no bleeding as such, very less bleeding, and the patient can be discharged within 24 to 36 hours, and he can resume his work back as soon as possible. So the technology has increased to that level that uh, people are probably unaware that even after undergoing big surgeries, they can go back to work probably a day or two after the surgery.
Yes, right, doctor. That means there are various treatment options which are available if somebody is having kidney stone. Doctor, sometimes people don't go to see a urologist. They just, treat by themselves. If some of their friends say, by drinking more water, the kidney stone will be gone. Or there's a misconception as well that if somebody will take alcohol, that can also dissolve the kidney stone. Is that true?
That is a very common misconception that we come across as urologists. So first of all, the basic, as I've already told you, there's no role of alcohol or beer as such to to dissolve the stones or to remove the stones. There's nothing of that sort. In fact, for that matter, the environment that the alcohol creates in the body, it actually propagates more stone formation. So it is a misconception that it dissolves the stone. The basic thing that happens is whenever somebody takes alcohol, whenever somebody has beer, there is diuresis, which is formation of urine. There is more urine formation, and in that there are a few small stones that may get passed off. So people try to correlate the two, thinking that if we have more alcohol, more stones will get passed off, which is not the case actually. So, and the same effect will happen if you have more water. So there's no literature which says that beer or alcohol can dissolve any kind of stones.
Okay, so as doctor said that alcohol cannot dissolve your kidney stone. So if you're having any kind of problem too, go to a urologist. Doctor, when we are talking about the various treatments, so what size of kidney stone are eyes to be treated?
Yeah, so as I mentioned, about 10 millimeter, 8 to 10 millimeters is the cutoff size that we keep for medical and surgical management. If it is more than 1 centimeter, we definitely have to intervene through some sort of surgery. And the as I've given you the examples, there is PCNL, mini PCNL, RIRS. There is even below mean, there are ultra mini PCLs, micro PCLs. So uh, as we are progressing, the size of the scopes has also started decreasing, and it is now reached a point where there is almost an incisionless treatment to all the stones. As big as they are, we can remove them with just a small 1 centimeter, 0.5 centimeter incision.
Right. So, as doctor said, there are treatment options which are available, and with the use of technology, it is more advanced, right, doctor?
Yes, yes, and with time, even the lasers that are improving, that is also helping our cause. That is also helping us finish the surgeries in a better manner, in a faster manner, and the patient is, stone free in a very small amount of time, and he can go back home. Within 24 to 36 hours, we generally discharge our patients.
Right. So if you're having any kind of symptoms of kidney stone, do go to a urologist. Do not self treat it as well, doctor. I'm sure that you might come across many patients who have already self treated the kidney stone, and then when they have a lot of pain, they are coming to you that now
Yeah,
what
that
we
that
can do.
that is obvious. That is obvious because generally there is a tendency to, there is a fear to go to the doctor. There's a fear to, reach out to a specialist to treat yourself, and generally you try and manage it on your own. But the important thing is the kidneys are vital organs of our body, and even a small stone, if it is at the if it is at a place where it can cause damage to the kidney, uh, it can be a life threatening situation. It can lead to a life threatening situation. We've seen patients with stones as small as 6 mm, 7 mm, causing damage to the entire kidney, pus formation in the kidney, that pus going into the systemic circulation, and the entire body getting going into septic shock. So even a small stone can be a cause for a very big thing. Generally, it does not happen, but you can never be sure of anything. And when we have all the treatments in our practice, it's very easily available, and most of the patients are they once they get the treatment done, then they understand that it was what we have suffered for so long. We could have easily gone through the treatment earlier.
Right, absolutely, doctor. So do not self-treat yourself if you're having any kind of symptom. Do go to your urologist, doctor. When we are talking about kidney stone, there's a question which occurs that can kidney stone cause renal dysfunction?
Yes, so kidney stones, as I had given you an example right now, kidney stones can cause renal dysfunction because uh, there are a few stones which they do not completely obstruct the renal system, the pelvic calyceal system. They are called staghorn stones, which take the shape of the entire pelvic calyceal system, and there is a certain space left where urine can pass. So in such patients, there are large stones where there is no symptom to the patient. The patient does not have any pain, does not have any urinary symptoms, and still he's carrying a big stone, and he does not know about it. So in such patients, the function of the kidney deteriorates on a very gradual, and eventually the kidney stops functioning. In another way that I can explain is when there are stones that have been there for a long time, you know about them, and you're ignoring your symptoms. You're not taking care of it. So in those cases, also the kidneys start deteriorating, and the symptoms of that are morphed by other things. So patient will feel that I'm having fever because of some other cause. Patient may feel that I'm having I'm not having the kind of pain that a general patient has. So there is a little bit of doubt in the patient's mind, but the end result is so severe that he may have to end up losing his kidney. Although by God's grace, we have two kidneys, so the other kidney takes up the work for it. But it's always necessary to be aware of of your body, of your symptoms, and a simple ultrasound can detect the stones, can detect the functioning of the kidney. And the way that the era that we are in, we should be very aware of our body and our health.
Right, definitely. We should not ignore the symptoms, and if you are having any kind of symptoms, do go to the urologist, because that is the most important thing. Doctor, when we are talking about the renal dysfunction as well, so are there any food which causes renal stone?
Yeah, so food is a very important factor, because the kind of stones that are made. So there's a large group of stones which are the calcium stones, which are calcium oxalate stones. So oxalate rich food is to be avoided. Oxalate rich food is basically your chocolates, coffee, caffeine, tea, coffee, beans, sprouts. So these are the things that have to be had in moderation to avoid formation of oxalate stones. Then there are a few the uric acid stones are caused by animal proteins. So red meat and the animal protein diet should be moderated. It should not go beyond about 1 to 1.5 grams per body weight. So not more than, actually, one gram per body weight should be the ideal intake for the animal proteins. And uh, the most important factor for all kinds of stones, irrespective of its type, is the fluid intake. So we have to have we have to have about a 2.5 to 3 liter output every day. So it's not feasible for a patient to how much is the urine output to measure it on a daily basis. So we advise them to have about 3 to 3.5 liters of fluids every day, so that they can have at least that much amount of urine.
Okay. So, doctor, as you have mentioned that 3 to 3.5 liter of fluids, liquid fluids every day. So, is there any specific kind of liquid intake we should take daily?
See, water is the best fluid. Water should be the major part of it. Other than that, we can have the juices can be in the can add it to the fluid intake. But we have to be very careful. We should not add the aerated drinks. We should not add the sodas. We should not add the soft drinks that we have on a daily basis, and also alcohol. So all of these will cause diuresis. It will cause increase in the urine output, but they will also cause acidifying, it acidifies the urine. So that becomes more prone to stone formation, for infection in the urine, for the stones that are already there, they can accumulate to become bigger stones.
Okay, okay, doctor. And is there any difference, or what is the difference between gallstone and renal stone?
Yes, so this is also a very common thing that we face in our practice, where a patient just comes with the complaint that I have a stone. So where is the stone? We don't know where the stone is. So in the human body, the genitourinary systems has the stones, which is the kidney, ureter, bladder, that can have stones. Also, the gallbladder can have stones. So the gallbladder is part of the digestive system. So when a patient has gallstones, he will have pain in the right side of the upper abdomen, or in the center part of the upper abdomen, and the pain will generally be, uh, you know, probably after meals, or the patient will have feeling of bloating sensation. These are the symptoms of gallstones. They will not be associated with any urinary symptoms. They will not be associated with any anything in the urine. So that is these are the symptoms of gallstones. And gallstones do not have a medical treatment as such. If a person has gallstones, he will have to undergo a surgery, uh, irrespective of the size. So, and kidney stones, as I've already explained to you, the symptoms are a little different. although sometimes when a patient has stone in the right kidney, it is quite close to the same place. So if a patient comes with pain in the right side of the abdomen, it is difficult to differentiate between the two. But still, with the investigations and the ultrasonography radiological investigations, we are easily able to differentiate between the two.
Okay, so that's the types of symptoms or a difference between a gallstone and a renal stone. Doctor, as we are talking, we also have some live viewer questions who are watching this live. So there's a question from a viewer: can you provide guidance on how to balance my overall health and well-being to prevent kidney stones in future?
Yeah, so the primary guidance is your food habits, your feeding habits, and your lifestyle modifications. So if because he's asked this question, I can give him an example that if a person has a stone and he has that stone removed either surgically or medically, he or she has a 50%, 50 to 55% chance of getting another stone, a new stone in the next 5 to 6 years. So that's a very high number. That's a very high number to be, to deal with. And so the patients who undergo treatment for kidney stones, they are advised to change their lifestyle for the rest of their lives.
Okay, that means I hope that is answering to your question as well. We are talking about kidney stone, and we have with us doctor, and he'll be back soon. So as you're talking, we were talking about the types of kidney stone, the causes of kidney stone. We have discussed about what fluids you should take if you are having any kind of kidney stone. There's a difference, as doctor mentioned, between gallstone and renal stones. We have discussed that as well, that how generally these stones can be treated, and with the modern technology these kidney stone can definitely be treated. Dr. Siddhart Singh is with us and he'll be joining us soon. And we have also talked about the types of kidney stone. Do not self-medicate if you're having any such kind of symptoms, because it is very important that you should go and refer a urologist. Do not self-treat it, as doctor said that there is a misconception as well that drinking alcohol can dissolve your kidney stone, which is not true, because if you take more liquids, that is more important. So we have discussed about how the various misconceptions of kidney stone is there, what are the types of kidney stone, what are the causes of kidney stone, and we were discussing about the work-life balance, which Adi has asked, can you provide a guidance between how to balance the overall health? And as doctor mentioned that if somebody is having kidney stone, if he or she is not taking care of themselves, kidney stone can occur again. And kidney stone, as we have discussed, are hard deposits made of minerals and salt that form inside the body. Diet, excess body weight, some medical conditions, as we have already discussed, can be certain supplements and medications are the causes of stone. And as we have discussed, there are types of kidney stone like calcium, uric acid, cystine stone, and many more. Gallstone are different and renal stone are different. The symptoms of both these stones are different as well. So whenever you are having any kind of symptoms, pain, or any such kind of symptom, you should definitely go to a urologist who know how to treat the kidney stone as well. Stones can occur within the kidney itself and as well in the ureter, as discussed, and it is better that you consult a urologist, and he or she will definitely resolve your issues as well. We have some questions as well. We'll be taking those questions as well as soon as Dr. is again with us. Also, you can, as we have discussed about the genetic causes, why the kidney stones are more prevalent nowadays, and as doctor said that because of lifestyle changes, the kidney stone is becoming more prevalent nowadays. What are the dietary factors? As doctor said that you should not take high amount of caffeine, cold drinks, soda drinks, because that can also be a cause of kidney stone as well. Liquids, when we were talking about that, what liquid intake we should take daily, doctor mentioned that drinking more and more water can definitely help you in if you are having kidney stone or any kind of symptoms of kidney stone. And as we have discussed that with difference between a gallstone and renal stone, so the symptoms of both these stones are different. So you make sure that if you're having any kind of symptoms, you will definitely refer to a urologist and do not self treat it, because I've already mentioned that he has also came across some people who have already treated their stone and now they are not in good condition as well. So do not self treat your kidney stone. Do not do that, because it is not good for your health as well, and it can definitely make your health more worse. So do not self treat it, because it is not good for your health. Do not take liquid which are harmful for your body if you are having any kind of symptoms. So do refer to your. Welcome back, doctor.
I'm sorry, I had a network issue.
It's okay, it's okay. And we were discussing about the question which came from our viewer that can you provide guidance on how to balance my overall health and well-being to prevent kidney stone in the future?
Yeah. So I was just saying that, fluid intake should be more. The kind of food that we need to have, I've already explained that. And other than that, we need to be, on a regular, we need to follow up with our urologist. We need to have a regular checkup every, at least ultrasonography every year. And if the patient has had, multiple stones in both kidneys, then even urinary and, evaluation of the renal function test along with that.
Okay, okay, doctor. There's another question from a viewer asking, are there any signs or symptoms that indicate I should seek immediate medical attention for kidney stone?
Yeah. So the commonest symptom is pain. So if you are having any kind of pain in the side, on the sides and at the back, which is going down to the lower abdomen, so that is one thing that should guide you to a urologist. Second is your urinary complaints. So if you're having problem while passing urine, if you're having burning, if you're having to go multiple times to the washroom, if you're feeling that once you've completed your urine, you're still having some sort of tendency to go back, you're not your urine is not complete. If there is any sort of blood in the urine, that is a very grave situation where patients come to us with painful or painless hematuria, as we call it in our language. So that is another sign. And nausea and vomiting are generally, they are late signs. But if somebody is coming with that, then all of these signs should lead you to a urologist as soon as possible.
Okay. And doctor, what is hematuria, as you have mentioned? What is
Hematuria,
hematuria?
yeah, hematuria. I'm sorry, I used a medical term. Hematuria is basically blood in the urine. So any kind of redness or blood in the urine is not normal. And if anybody is having this symptom, if anybody sees that there is blood coming out from the urine, he or she should immediately seek a urologist's help, because it is not something that is normal, and it can be something that is that needs to be treated immediately.
Right. So if somebody is having blood in their urine, they should definitely, it should be treated immediately.
Right.
Doctor, there's a question from a viewer asking, how frequently should I get follow-up tests or checkups to monitor my kidney health?
So if somebody is symptom free, does not have any symptoms, does not have any problems, then there's no need to get investigations done unnecessarily. But if somebody has had a history of renal stones, somebody has had, somebody in the family has renal stones in the past. So these people should, even if they are asymptomatic, they should at least get an ultrasound done, because the ultrasound is a very simple, easily available, cheap investigation which everybody can afford and everybody can avail. And it is the easiest way to find out even a small stone in the kidneys or in the ureter or in the bladder. So if somebody is at least an ultrasound should be there. But for those patients, as I mentioned earlier, the patients who have had a history of renal stones, they need to be on a follow-up, on a regular follow-up, as their urologist advises. And if they have had problems like kidney dysfunction, then they have to be on a follow-up with the urologist as well as a nephrologist. So it differs from patient to patient. But if somebody is absolutely symptom-free, there's no history in the family, and there are no symptoms, then it's not needed that you purposely go and get some investigations done.
Okay, doctor. And there's a question from a viewer asking, can stress or certain lifestyle factors contribute to the development of kidney stone?
So stress as such is not directly related to kidney stones, but stress can cause, multiple other medical problems, and that could, eventually lead to an imbalance of the body, and that could lead to stones. But there's no literature available for a direct correlation between stress and stones as such. Lifestyle factors, obviously, they matter. How much fluid intake you have, what are the food you're eating, I mean, if you're going for a walk or not, how is your lifestyle? Is it if you're not having to do much, if you're not walking too much in the day, even that can cause you to take in less water. So as we see, we are all surrounded by ACs, and we sit in an air conditioned environment. So the fluid intake has gone down considerably as compared to our elders, as compared to the previous generations. And that is a major factor for us having a more incidence of kidney stones as compared to them.
Okay, doctor. And as we had discussed about the type, the symptom to treatment, there comes a question that sometimes there is it like that it is not necessary for someone to have surgery as well? Are there any stone that dissolve with the medications as well?
So the dissolving of stones is a thing that is still in research. It's not completely proven that any drug is going to dissolve a certain kind of stone. If it's a small stone, it will pass off. If it's if the consistency of the stone is soft, so it will pass off with the excess urine. It will just dilute itself with the urine and pass off with the urine. But if it's a hard stone, if it's a big stone, then there's no medication that is going to dissolve a stone into, if it's a 3 centimeter stone, it's not going to dissolve it into 1 centimeter, 3 stones. So there's nothing like that. But the smaller stones, we give some medications that allow the passage of the stones.
Okay, doctor. And any after surgery advice you would like to give to all the people, or to take preventive measures if somebody is having kidney stone, and if the kidney stone should not reoccur? Any
Yeah.
lifestyle changes or preventive measures?
So you have to have a good fluid intake. Your that is the primary goal for any patient. He has to have about 3 to 4 liters of water every day, and he has to have a good some sort of exercise, brisk walking. If he can exercise about 30 to 40 minutes every day, that should be the goal. And the feeding habits I've already mentioned is there are things that he should avoid, there are things that he should take more, and all of this is very easily available nowadays with the internet. Everything is available on the internet, so patients can go on the internet and find out what are the food items that cause renal stones, and they can accordingly change their diet, they can modify their diet.
Right. Rightly said, doctor. And any advice you would like to give to the people who self-treated, their problem?
See, there's there I cannot say too much about it, but the thing is that the bottom line is that even a small stone can cause a big problem. So you should not be you should not take it for granted. That is all that I have to say. But it is not, and the patients that come to us, it's not that we advise them surgery on the first go. It's nothing like that. It depends on the size, it depends on the location, it depends on the patient himself, how how well he is to do. So according to that, if the best possible management that is there, we provide that to the patient, and then accordingly we deal with it.
Rightly said. So if you're having any kind of symptoms, do go to urologist. Do not self-treat your symptoms, and do not self-treat your kidney stone. We have discussed about the symptoms, the prevention, the causes, the different types of stones today in this session. Doctor, any advice you would like to give to all the viewers who are watching this live?
Yes, I would like to bring to everybody, everybody should be aware of the symptoms of kidney stones, because it's becoming very prevalent, and they should also be aware of the options that are there to manage these stones. So there is a misconception amongst the people that if I have a kidney stone, then I'm going to, have a big surgery. There's going to be 8 to 10 days of hospital admission, and I'm going to have long term difficulties in getting back to my normal course. So that is a thing of the past that used to happen 20-30 years back. And with the newer technologies coming into our armamentarium, we are able to give the best possible results with the least possible effort. So it's good for us also, and it's absolutely it's magical for a few patients. They don't believe that they are stone free in such less time.
Yes. And Doctor, any takeaway message for all the viewers?
Yeah, so I think not just kidney stones, urology, all the other urological problems, such as the prostate, the bladder, these are problems that patients, they uh, because of a taboo, because of a social taboo, they kind of ignore, they kind of they are afraid, or they don't want to disclose it to their near and dear ones, to their doctors. So we should be we are living in a society where uh, everybody has access to all the information, and we should be aware that when we need to be treated, when we need to go to the doctor, we should not continue to ignore our symptoms. And the subject as such covers a lot of other aspects as well. So when you meet a urologist, you'll be able to not just your treatment, you'll also be able to understand how to take care of your body for the future as well.
Right. So do not be afraid if you're having any kind of symptoms. Do go to your urologist. Do not self-treat your kidney stone. Thank you so much, Dr. Siddhart Jaising, for your valuable time. And it has been quite an informative session for our viewers.
Thank you so much. Thank you so much.
And Doctor, we really look forward for many more sessions in the coming time as well.
Sure, no problem. I'm always available for any kind of such awareness programs are very helpful to the general public, and they must be carried out from time to time, so that we can provide this information to each and everybody.
Yes, definitely, Doctor. Thank you. Thank you so much, Doctor. And thank you so much, all the viewers, for an excellent participation. For more information and updates, stay connected on our Facebook page, that is Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you and good day.